make it fun.
Welcome back to Full Circle with Wikali. A very good morning to you. How you doing? Well, you're tuned in from 111 That is our SMS line, Switch TV Kenya on Instagram, Switch TV Kenya on Facebook. I love the conversations that we have on this show because we move from one thing to another, life-changing things, and this is that conversation. We have a change maker in the building. She's an entrepreneur, she's a philanthropist, she is professional health giver, server, something. She is into that world, but over and above all of that, she has the heart for people, for children, and she has the heart to give back to society, and she's doing something really big in the country, and I'm excited to hear all about it. Christine, welcome to the show.
Thank you for having me.
You look fantastic.
Oh, thank you.
And I know I did probably a not very good job at the introduction. If I left it or anything, this is the time.
Oh, you could have done better.
Yes, but this is the time. Do it.
Okay, so my name is Christine. I'm happy to be here. My background is in healthcare. Yes. I think I live, breathe, drink, sleep, everything healthcare. I got into healthcare when I was like 22 years old. I'm also an entrepreneur, so other than working, I have my own businesses. I'm also a mother and a philanthropist. So like you said, I love children. I'm a patient advocate at a big children's hospital, and that's basically it.
Great.
That's me.
And you're doing something, before we get to what you're doing here and what your heart, the direction that your heart, everything that you've done in the past is directing you to now. And as Kenyans, I think we're really happy that this is happening here for us. You have a bit of background out of the country as well. Maybe you can tell us a bit more about that.
So I live in the United States. I practice and have practiced in the United States. So in the United States, I own a hospice agency which basically deals with the terminally ill patients. We are stationed in Arizona and also in Nevada. Other than that, I come from a family of mental health, practitioners and providers. My mom is a mental health physician. She's a psychiatrist, and my sister is a mental health nurse. So because of them, they drew me towards the mental health side of life. So other than the terminally ill, which that's my business, I also now am fascinated about mental health, and that is specifically drug addiction. Yes. So that's what I basically do, and also other things in our society to try and make it as better as we can.
We are here for it.
There we go.
You're launching something huge in the country. And it's for us. And it's beautiful that you could have done it anywhere else in the world.
I could have.
You could have.
But this is home.
You came home.
This is home.
You came home.
Yeah.
Please tell us about it.
So we are launching New Health. It's a New Health Medical Center and Rehabilitation.
Okay.
This is something I would say I wanted to do for the longest. I normally tell people, one, when you're starting a business, seek what speaks to you, what talks to you.
Yes.
Because your passion takes you through the hardships and the hurdles of life. I think a lot of people fall into the money factor and not the change factor. For me, I try to make a difference in everything that I do because that's what, gives me the satisfaction. So coming to Kenya, I decided to open New Health, which is going to be a rehab center. It's based in Kitusuru. And I know a lot of people have said that sounds like it's going to be like a very expensive rehab.
End.
That was your question. And I'm going to answer that.
I was going to go there. You saw it.
I saw it
like,
coming.
To where? Okay. Cool.
Yeah. So with one thing that I believe in, when you're a provider in healthcare, it has to be individualistic. I cannot treat you the way I would treat the next person or the next person. And for me, it's not about the pocket. It's about delivering the best of care out there for anyone. So how we are going to be doing it, it's going to be customized based on what someone can afford and what their needs are, because that's the only way you can make a difference. So before I launched New Health in the country, I did a lot of market research. And the one thing that I'm not going to do is to offer rehabilitation for 3 months. Not to say that it's wrong, but for me and my standards and for the people that I love that I'll be taking care of, I feel that's not time enough for someone to really be rehabilitated and be confident out there to say that now I'm ready to go back into the society. So what we are going to do is, by the time they're about to walk out of my facility or New Health, our facility, let me call it that way, they'll be paying close to nothing, because that's just what I want to do. And I feel by so doing, I'm going to be making a huge difference. My other goal is to bring a lot of education through our outpatient, because we are going to have an inpatient, we are going to have an outpatient and a detox center. So through our outpatient, I really want to reach out to the families affected by, the user and, the effects that go, because I feel like a person who is going through, addiction, it's like a roller coaster.
It affects everybody around you.
It affects everyone.
That's
and
true.
Finally, it drains you. And that also comes with the stigma of it. So we are going to be offering a lot of, education to the society, to our communities, and that will be done for free. I'm not going to be charging anything for that. Christine, yes.
Wow.
Yeah, so outpatient will be for free. A lot of talk to children who have parents who are going through addiction. A lot of talk to parents who have children who are going through addiction. And then for me, my focus and how I provide my care is to first understand what is the trigger. Why is this person using? Because there's always a reason which we fail to look into.
So we just treat the alcohol.
We just treat the alcohol. So what happens is, if I don't deal with the triggers, once this person goes home or goes wherever, then there's a trigger.
The trigger
then we
is
see.
waiting.
There you go. So my patients, I want to understand what's the trigger, why and what led you to this path. And if there's something we can do, probably it's something within the family, family surrounding, then I'd like to deal with that. Probably a child feels, I'm not confident because my mom tells me these words that are very toxic. And so we want to talk to the mom and make her understand that this is the trigger. We want this child to feel, well, let's build the confidence, and then that will help into the, lead into a smooth recovery process. So with my education and how I practice, I always when I do the circle, which shows an organization, I put the patient in the center and then the community and all the providers around it, because we are there for our patient. And when you do that, then you're able to deliver the best of care possible by first understanding the patient and knowing that beside anything else, we are here for this patient. So the other thing I look at when delivering care is the number of graduates. How many people are going through our program full cycle?
Okay.
Because if I get 3 patients who fall through the cracks within 3 months, that tells me I'm failing somehow.
Okay.
I want to see a lot of my patients going through 6 months to a year of rehabilitation, whether through inpatient or outpatient, and that will give me the satisfaction, because then I know I'm doing the right thing.
So will we have a timeline for this? Because clearly 3 months is a no-no for you.
For me, it's a no-no.
Yes. So do we have a timeline for this? Or it depends with what I come in with, what situation I'm in at that particular point, for you to be able to be like, you know what, no timeline, let's just do this until we're okay.
Let's do it until we're okay. Until my patient comes and tells me, Christine, I'm ready now, then I'll be okay. But normally it's usually 6 months to a year.
Okay.
So 6 months to a year, I think that's enough time to really do the right thing, for this particular person.
Okay. We've been talking about alcohol addiction for a bit, I don't know why intentionally or not, but does this involve all other kinds of addictions?
It's all kinds of addictions, cocaine, meth, everything. So we are not only focusing on alcohol, because truly we are not just dealing with alcohol.
That's true.
Especially with a lot of people adopting the Western kind of doing things. We are finding that, in this country, unfortunately, we have cocaine coming and cropping up, heroin and all that stuff. So we are going to be addressing all kinds of, drug addictions.
Okay. Now, having been in the States, practiced there, having come home, I'm sure you've seen what we have here in terms of facilities that take care of people with addiction. Why are you smiling?
I'm ready for that question.
Having seen that and the care that is given, the pre, during and after, what are we doing wrong? If we are doing it wrong?
That's
in comparison to.
So I wouldn't say doing it wrong.
Yes.
I think there's room for improvement, just
Okay.
like there's room in so many other areas and so many other things that we do in life. So I do not want people to come and say that lady who went on, she was, no, that's not my intention. I believe there's room for improvement. So for me, I did market research, and there are those things that I would like to implement that I think are not being implemented here. For example, dealing with the triggers is one thing.
Yes.
People come in and you want them to be rehabilitated, but you're not dealing with the root cause of the problem. So, and the other thing I've seen is that people not incorporating their extended family, friends, to figure out, how can we make this much easier, and not dealing with the stigmatization. So basically, when I looked for my facility, I wanted something really, really private.
Okay.
So that whoever who walks in there feels, hey, this is private for me, and nobody is going to question, nobody is going to, think of me this way or that way. I want people to feel confident from the minute they walk into our gates and our doors. So in terms of delivery of care, there's a lot to be done. There's a lot to be, touched on, and a lot to be educated on when it comes to mental health. And so I believe working together with my community and my other providers, of course, we can attain that with time. It will take time, but there's a lot to be done.
Okay.
Yeah.
With addiction comes a lot of stigma. And you mentioned it just now. The community, the way it looks at a certain family, the way this person will be looked at even after coming from rehab. They've gone through the whole process, their life has changed, and they're ready to come back into society. But then there will always be people looking at them different, not thinking they've really handled it. Stigma generally. How we handle it here, do we have systems in place? Or rather, do we have systems in place from where you're coming from?
So we have stringent systems in place from where I'm coming from.
Yes.
I have seen it fail because I took the entire month of June to educate my own employees.
You did what?
Yes, I did that.
Yourself?
Myself. I would wake up in the morning and just train all my employees. So they're ready and trained based on what I want to deliver. So to go back to your question about stigmatization, I think it's mostly lack of knowledge out in the community. Some of these drugs are fairly new in our country. So I think with education, we should be able to deal with the stigma involved when it comes to addiction, because to be honest with you, addiction is a disease just like any other disease.
Yeah.
It is. And once we understand let me give you a story.
Okay, please.
So the reason why I fell in love with mental health is because, one, I came from dealing with patients who have cancer. Patients who had no choice whatsoever, because when you get cancer or when you're going through that huge life-changing experience to death, you have no choice. So my parents and my mom, my sisters, we always sit down and compare notes. What I do as a care provider, as a healthcare practitioner, and what they do. And my mom has great passion when it comes to mental health because her brothers went through it. And so they gave me an example and told me, Christine, let me ask you, you say that people who are addicts, or going through addiction have a choice. And which is what a lot of people believe, is that this person had a choice not to smoke that marijuana. They chose it. But the story I was given changed my perception when it comes to addiction, because my sister told me, Christine, I had a patient today. And that patient, from when he was born, the father was a drug addict. And what he would do is he would take his formula milk and put alcohol into it.
No way.
When this kid was an infant. And so what happened is at 6 years old, the dad would now put meth into his milk. So this patient was 23 years old, totally addicted to drugs. So did this person have a choice?
No.
There you go. So that's why I want to deal with the triggers. I want to understand my patients, because for me, from where I sit, I have seen stories both ways, where people had no choice whatsoever. And at times we point fingers, and yet when you look deeper into it, there's a root cause of it. These people didn't have a choice most of the time. But we think, okay, this person had a choice. They had a choice not to do ABC, or they're being naughty. Not to say that there are people who use it for recreation. There are people who use it to escape whatever they're trying to run away from. But please, let's not judge. Let's be there for these people, because they're the most kindest, loving people I've seen. And they need that help without judgment.
Okay.
Yeah.
Going through the process of rehabilitation and now coming out of it, rejoining society, do we have probably a system or a process of equipping them to fall back into society? And maybe they lost everything that they had. They need to start from scratch in terms of even getting a job because they couldn't keep one to start with. Do we have that in place as well?
Yes, we do. Okay. So with our outpatient, we are going to have social workers. I'm going to try and work with our community as much as we can. With time, my prayer is to start a non-profit that, will be taking donations and grants to help these people start little businesses if they can, if they need to. With our outpatient, I believe we will be able to equip them, one, support systems after they leave. If you want to scream, yell, you feel that there's a trigger you want to use, come back to us and we'll talk you through it and we'll hold your hands. So we are putting a lot in place, and I have, a lot that I'm dreaming of. It's my prayer that God will give me the strength and the support that I need, because it takes everyone to make a change and a difference. So with that help and with what we are starting, I hope that we'll get the support we need in order to put everything and make everything work for our patients.
Great. You have a picture for this, and I see it.
Well painted.
Yes. I see it. I have visuals for it. And it's starting here in Nairobi. For people who are not probably able to access it in Nairobi, is there a plan to probably, how are we going to fish out or get people who are probably not able to or do not know? Is there a plan to take it to Pengine Mashinani?
Someone made a huge offer to me, and I'm still working on it.
Okay.
And it is in Mashinani. So I'm willing to take whatever challenge. I tell people, as long as I'm healthy and as long as God sits on the throne, I'm able to do anything. So someone made an offer and it sounded really good, because basically for me, it's about the change. It's not really the finances and all that. I have been blessed to have that. So I'm thinking about it, and we'll see where we go from here.
We will be here for it if you make that direction, if you make that decision, if you take that leap of faith, because they also, when we talk about addiction, we look at the CT a lot.
Yes.
But then kuna addictions zingine pia ziko kule nyumbani, where they would need also to get these kinds of facilities. And if you're the person to do that, why not?
Why not?
Why
I
not?
might be the first. You never know. There's always a first. There you go.
Please, your parting shot for everybody who's just watching this for the very first time, not knowing what to do or did not have an idea of, where to take their loved ones or where to go themselves as well. Location, that's private, right? But
it is, unfortunately.
Yeah, that's okay. But how can they get in touch with you directly for all of that as you give your parting shot?
So I want to let all my Kenyan families and friends know this. It takes you and me to make these people comfortable. And it's nothing new. It's been there. It's nothing new. I know it affects everyone. It's nothing new. And all it takes is the support that, these individuals, an addict needs or addiction needs to get sober again. Let's not forget who these people were before addiction.
Yes.
Let's think of sobriety and how to make better persons out of them.
That's true.
So to me, I would say it's nothing new. It's no different from, any other disease. We can deal with it as a community and help them get, back to, where they're supposed to be. To contact me, you can reach us. We're on all, social media platforms as well. We have a director. Her name is Audrey. She's wonderful. Her phone number is...
Yes, this is your camera. Go right ahead. Let's give out her phone number.
Her phone number is 070354787.
Just say that again.
07035476787. I had to write it here. It's brand new to me. And then we also have a website. It's www.newhealth.co.ke.
And that New Health, we have to say it well before. It's NU,
NU,
right?
New Health.
Yes. Before mtuandike new ya mpya.
Yeah.
Well, so New Health, that is the website. Social media, same handles?
Same handles.
So new health everywhere.
Everywhere. So
Okay.
it's new health for everyone.
Oh,
There you go.
all the best.
Thank you.
How long has it been operational, or did you just
Since
launch-
June.
Since June.
Since June.
Fairly new.
Fairly new.
Energized, ready, waiting for you. If you need help, do
Yeah.
not suffer alone, because there's someone out there willing to hold your hand, willing to walk the journey with you. And yeah, this could be a life-changing experience. So thank you so much for coming through, Christine.
Thank you so much for having me.
We're going to take a very short commercial break. We will be right back. This is Full Circle with Wikali.
Thank you so much.